past the top of the hour. Karibu sana. This is a Morning Cafe, and we're getting into the conversation in health matters. This morning we're discussing matters pelvic pain, mostly in men and women, and we'll be getting to understand which gender is really more susceptible. And to help us have this conversation is Dr. Bruce Sebo. Karibu sana.
Thank you very much for having me.
A quick intro before we also interact with the audience and tell them where to interact with us.
Yes, my name is Dr. Bruce Semo. I'm an obstetrician gynecologist by profession with an interest in a lot of conditions that actually afflict women. We know that women are actually forming a very big population of the people who are providing services in this country. So actually it's one of the most important areas that we need to focus on. Yeah.
Right. The last time we were with you, we were discussing matters in endometriosis, and one major thing that came up is pain is not normal, and pain should not be normal.
Yeah.
So we'll be getting to understand even from you, have you ever experienced chronic pelvic pain? Either you're a man or a woman, have you ever experienced any kind of a chronic pelvic pain? Talk to us on our socials. 0793-267-279 is the WhatsApp number. I'll be taking a look at it as we continue. You can also call us live, 0795-045-864. 22047 is our SMS number, and TV47 Kenya on Facebook will be having that question there. You can head there and talk to us. So even before we get to know where the pain is and all that, walk us through how the anatomy of the pelvis in both the women and as well as for the female as well as the male. Help us understand how it looks like before we get into the pain.
Yeah, so I think we'll start by understanding that when you're having pain in the pelvis, then the pain could be originating from a lot of structures in the pelvis. And like you have said, there are so many, what we call organs in the pelvis. And the pain can be originating from most of this. A lot of times when women present in the clinic, the most common presentation that women normally come with is pain. So it's important that we understand where exactly this pain is originating from. So we can have a lot of structures in the pelvis. We have what we were discussing last time, the uterus. Within the pelvis, we also have behind the uterus what we call the rectum. We have structures like the ovaries. And we have muscles here. We have nerves and nerve endings. We have the bladder, and of course we also have other structures like the bony structure that is actually supporting all these structures and the ligaments. So all these components, there's a way that they are connected each other to form what we call the pelvis in the female. Mm-hmm. Okay? So in the men, of course, there are structures that are missing, like the reproductive system is actually a bit different in men than in women, because in the men we don't have the uterus, we don't have the ovaries, and we don't have the fallopian tubes. So the difference brings the changes. You find that the chronic pelvic pain is actually common in women than in men. Mm-hmm. Yeah. So
even apart from the fact that, there's such, because I'm taking a look at also, even for the male pelvis, it supports the heavy build, as well as now for the female, it can support the child bearing. This really has to do with even its anatomy. Do some of these factors also are they some of the factors and causes of the pain in the pelvis?
Yes, so the causes of the pain in the pelvis, most common people who present with pelvic pain are actually women than the men. I'm not saying that men don't have chronic pelvic pain, they do, but over 90% of the people who complain of chronic pelvic pain are actually the female population than the male population. And so it's important that we understand also that the most common presentation of chronic pelvic pain in the gynecological clinic is actually a complaint that is being presented by women than in men. And being one of the populations that we are actually serving a lot in the reproductive system, the gynecologists, then we normally tend to focus more on chronic pelvic pain in women. That is not to say that we don't have chronic pelvic pain in men, because there are other conditions that actually cause chronic pelvic pain that are actually present in women and in men, and we are going to look at them.
Right. According to International Association for Study of Pain, it says that this pain, the pelvic pain, lasts longer than 6 months, even in its definition. Walk us through, because as you say, there's no normal pain. When you feel a certain type of a pain, seek medical attention. So when we come across such, that means that you probably experience it, but then it's only like a month or 2 months. So this means that you probably just have to wait for the 6 months and say, okay, imefika the 6-month mark, let me now start seeking for medical attention. Help us understand even this bit in your experience.
Yeah, so there is a standard, criteria that has to be fitting for us to say that you're actually having chronic pelvic pain. So number one, chronic pelvic pain is pain that exists in the lower part of the abdomen, that is beneath the belly button and the hips. Okay, that's in women. And this pain normally can be constant and dull, so it presents differently. It can be constant and dull, or it can be sharp, and then it can be also intermittent, meaning it presents at some point during the month and then it disappears, but it is always there for at least a minimum of 6 months. But just because you've had it for 3 months, it doesn't mean that you don't have chronic pelvic pain. For you to wait for 6 months to be attended to in the hospital to say that you have chronic pelvic pain. Now, I want to bring in the concept that it's important that when you have chronic pelvic pain, one of the challenges and the reason why it is actually a very common problem is because most people who have chronic pelvic pain normally tend to make a diagnosis of themselves on what they think is happening based on what they were treated before, and then it becomes a habit of getting treatment by themselves, over-the-counter treatment. And you could be treating a condition that is actually very, very severe, and it is progressing to a point where it becomes very debilitating and making your quality of life very poor. So number one, we must say that the pain has been existing for 6 months. Number two, it presents differently. It is either intermittent, meaning it comes at some time in the month and then it disappears, or it can be constant and dull throughout the period of the month, and you've been seeking treatment for more than 6 months and this condition is still not there. Now, chronic pelvic pain is not associated with pregnancy. So if you're pregnant and you've been having some type of pain during this pregnancy for 6 months, we cannot say that is chronic pelvic pain.
Okay.
That's a whole different type of pain in it.
Right.
So it doesn't involve women who are pregnant.
But then, even for this 90% that you've told us, are most of them, do they have underlying factors that, even apart from this pain, for example, you probably have endometriosis or even some pain, the menstrual kind of a pain. When they come to the doctor, do you think chances are high that the diagnosis of the pelvic pain might not really happen because even for the underlying factors?
Sorry?
Due to these underlying factors that this patient might have, and this patient being the woman, because you've told us 90% of them are women, they might come to see you with underlying factors, underlying conditions like endometriosis. So do you think chances are high that even the medical professional might miss to diagnose this pelvic pain?
Yeah, it's a common problem that we have, that a very large percentage of people who actually have chronic pelvic pain will go through a series of tests. And almost up to 50% of them, the diagnosis, or rather the cause of the chronic pelvic pain, may actually not be picked by the routine tests that we carry out. And so we find that a lot of times the women who actually have chronic pelvic pain end up receiving treatment that is not addressing the actual problem or actual cause of chronic pelvic pain, which makes it a dilemma, because we end up with women who are going through a very long period of time getting treatment for a condition that they've already been informed they have, and they reach a point where now they're actually doing self-treatment. I'll give you an example. The most common presentation for women who have chronic pelvic pain in the clinic, normally they don't come and say they have pain. The report they will give is that I have a urinary tract infection that has been existing for so long and I keep on taking antibiotics and it's not getting well. So what is happening? They have this pain, they walk into the pharmacy, they say I have a urinary tract infection, it's causing me pain. They believe that the pain is originating from the bladder. And like we said, there are so many structures in the pelvis. And so they keep on taking antibiotics for so long, not knowing that this pain could actually be originating from something else. I'll give you some of the causes, like you could be having a bladder problem, you could be having a problem that is originating from the uterus, it could be a neuronal problem or a musculoskeletal problem, the muscles or the bones in the pelvis, or it could be a problem from the ovaries, an unusual ovarian mass. that is actually progressing to become something dangerous, but because it has been there for quite some time, they are self-medicating through over-the-counter medications. So it's important that we understand that chronic pelvic pain has many causes, and the chances of the diagnosis being missed is actually quite high. So the addressing of chronic pelvic pain is actually a multidisciplinary approach, meaning we need a team of doctors who need to come in and work together for them to be able to identify the actual source of this pain.
And you'd mentioned that so this patient would be run through a number of tests.
Yes.
Walk us through this kind of tests for someone who's listening and they probably now want to walk into the hospital. What kind of tests are they expected to be met with?
So before the doctor sends you for any tests, normally we get a very detailed history, okay? The pattern of which this pain started. When did this pain start?
Okay.
Where exactly are you feeling it? How many times during the month, or when did you feel it last? Are there any painkillers that you've been using, and is it making it worse or better? Is there any association of this pain based on your family history? Are there other members of your family history that are having this condition? Then based on this history, we can actually be able to tailor a certain approach to the investigations that we are going to do. So there is no standard pattern of investigation that anyone with chronic pelvic pain, we are going to do all these tests. It depends on what you're complaining from.
Okay.
It depends on how it is presenting, and it also depends on which treatments you've been receiving in the past. So it is a sequential process that we are following. But first we must be able to understand what is the history. And that is why it is very important that when you have pain in the lower abdomen, you seek help from a medical service provider, and you do not give up along the way, that I went there the first time and it didn't get better. Mm-hmm. And so now you start doing self-treatment. So the question that you asked, what are some of the investigations that we do? They're the common investigations. So we'll do some tests on the urine, okay? The urinary tests that we do. Mm-hmm. They're imaging tests, okay? Like the ultrasound. Occasionally we may even go further and do what we call the magnetic resonance imaging, the common MRI. We can do CT scans. There are tests on the stool, okay? And occasionally, if it goes too far, then sometimes we may even do what we call colonoscopy, which is actually a video visualization of the rectum and the colon, okay? And we may even go further and do some minor surgical intervention, what we call laparoscopic diagnosis, to be able to actually visualize the structures of the pelvis and see whether there's a problem there. So these tests are actually sequential depending on how the pain is presenting and how you're responding to the treatment that we are taking. Mm-hmm. So the treatment of pelvic pain is sequential. It is not a one-stop treatment that you came and you had the pain, mm-hmm. and we already you have chronic pelvic pain, and there's a single treatment for the chronic pelvic pain, because the causes of chronic pelvic pain are different. So the first is to understand where exactly this source of this pain is coming. Mm-hmm. Yeah.
Right. And just a reminder, you can always be part of this conversation, 0795 045 864. That's the number to call in live, and Dr. Terry will be answering all the questions that you have regarding this conversation on chronic pelvic pain. He says 90% of people who really suffer from pelvic pain are women. And will be, from your experience, have you ever experienced pelvic pain and the chronic kind of pelvic pain? Share in your experiences and all those questions that you have. And even as we, talk about underlying factors. So, for example, this patient has come, and again, they probably have endometriosis. So, even after going through these investigations, so is endometriosis treated differently, and the pelvic pain treated differently? How does that work?
Yes, so they all have different forms of treatment, and occasionally you may even be sent to a different specialist. Mm-hmm. I know we discussed endometriosis last time, and so it has become this big issue, mm-hmm. because everyone thinks that any woman who has pain that has lasted for so long in the lower abdomen is actually being caused by endometriosis. Mm-hmm. But we are forgetting that there are other conditions. Some of them are not even related to the reproductive system. Mm-hmm. Like irritable bowel syndrome. Mm-hmm. It can actually cause chronic pelvic pain. Chronic bladder pain syndrome. There's something called chronic bladder pain syndrome, which is not even associated with an infection, okay? It's actually an inflammatory process that is happening in the bladder. Mm-hmm. You may have conditions that are affecting the ovary, and some of them might even be very, very dangerous, like early ovarian cancer. They may present with chronic pelvic pain.
Kidney stones also part of...
Kidney stones may present with pain in the abdomen. Depending on the location of the stones, if you have ureteric stones, then you may present with chronic pelvic pain.
Okay.
I'll bring out the other one, which is another common cause of chronic pelvic pain, which is pelvic inflammatory disease. Okay. Now, pelvic inflammatory disease is a condition where you have infection, okay, within the part of the reproductive system. Now, when the infection lasts for too long, then you have, chronic sequelae of inflammatory process that happens. And one of them, it's actually one of the most common causes of chronic pelvic pain, because it causes what we call scarring of the structures of the pelvis. And at some point, the infection may have resolved, but the effect of this infection that you had may actually lead to some scarring and damaging of the structures of the pelvis, which will lead to chronic pelvic pain.
All right. We have a caller right now. Trufena from Kisii. Habari asubuhi Trufena.
Nzuri sana, habari yenu?
Sisi tuko salama hapa kwa studio. Asante sana for calling. Uko na swali au uko na any opinions?
Yeah, nitaka tu congratulate doc, anaelezea vizuri. Yeah, well, and I thank him for that.
All right. So ameshukuru sana. Thank you, Trufena, for that. 0795-045-864. Kopale chini kwa screen yako. Do you have you ever experienced this, or do you know someone who has ever experienced chronic pelvic pain? Talk to us, and Dr. will be sharing, probably just answering your questions and the feedback that you have. So sorry to cut you short.
Yeah, so I was saying that the chronic pelvic pain is treated differently depending on the cause. And that's one thing people have to understand. So I want to discourage the idea of people doing their medication through over-the-counter drugs and pushing the narrative, especially to doctors and the younger healthcare providers, that I have a urinary tract infection. In fact, nowadays I equate urinary tract infections whenever a patient tells me that to the chance that they have chronic pelvic pain if they tell me that they've actually been going through treatment for this condition for 6 months or more. Then we start thinking that most likely there's something that is going on that is beyond an infection. Okay? And we need to look at it also from a broader perspective, that it has a very huge economic impact in our system, in terms of the cost that we are spending in the wrong treatment, the over-the-counter medication, the time that we lose when women are going to work, when women are supposed to be going to work and they're actually getting sick offs, and the time they're spending in hospital trying to get the treatment. So I think it's also high time that we start thinking as a country, is it possible that we need to develop a chronic pelvic pain center, okay? And maybe expand it across the country, because it is not a disease that is treated by a single entity of doctors. It's not that it's just the gynecologists who are addressing this issue. It's supposed to be a team of doctors. We need urologists to come on board. We need the orthopedic surgeons. We need the gyne-oncologists, the ones who deal with cancers and all such type of things, so that when the team comes together, then they can have a discussion on a case-based scenario, so that we can be able to understand where exactly this pain is coming from. There are even people who actually specialize in just managing pain only. Because like I said, most causes of chronic pelvic pain, we don't even have an exact cause of why it is there. Okay? Yeah.
Right. So back to the whole scenario of, okay, before that question, we do have Esther from Eldoret. Esther, good morning.
Good morning.
Thank you for calling us this morning. Habari ya Eldoret?
Eldoret ko salama.
Thank you. Do you have a question ama uko na maoni?
Yeah, niko na question.
Yes.
I experienced that pain like 3 days ago.
Okay.
It was so severe that I couldn't even sit or walk.
Okay.
Yeah, so I don't understand. Should I go to the hospital? Because it was just 1 day and then it disappeared.
Before that 1 day, how long has it has it ever happened before your 1 day?
No.
Okay. Can I have a doctor engage with you? Do you maybe akujibu for more questions?
Okay. That's okay.
Doctor?
Yes, so this is someone we are talking about who has had pain that has actually affected her quality of life in the sense that she couldn't move. So you can imagine she already lost some time going to work. But it didn't happen for quite some time.
She's still on the line, so you can engage with Esther.
Yeah, so my opinion for her will be that as much as the pain has disappeared, if the pain was there to an extent where you actually lost some quality of life, then it is important that you actually seek some medical care and not just ignore the pain because the pain has gone, because we still don't know what caused this pain. Okay? Yeah.
Okay.
Right. Asante sana Esther, salimia sana watu wa Eldoret.
Asante. Bye.
Right. Just a reminder again, 0795-045-864 is the number to call us live. Dr. will be engaging your feedback and questions that you have. Also remember, I'll be sampling most of your feedback on WhatsApp, 0793-267-279. You can text us also, number 2047 on our SMS number. So Dr. before Esther called, what I was to ask you is, so as much as you tell us that we do have the chronic pelvic pain being treated differently, as well as under other underlying conditions that are there. So does it mean, because I mean someone might be seeing that if you're going to be treating other underlying conditions, there might be, let's say, pain meds that are going to be there. So does it mean that subsequently it's going to also lower the pain that one has for the chronic pelvic pain?
It depends on what is causing the chronic pelvic pain. And I think we need to maybe just highlight some of the common causes of chronic pelvic pain. Then we look at the painkillers.
Okay, so before now we take a look at all those pains, we do have Jeremiah from Machakos. Jeremiah, habari asubuhi?
Nzuri sana.
Thank you for calling us this morning. Watu wa Machakos, I hope mko salama?
Tuko salama sana.
Okay, uko na swali au maoni?
Niko na swali kwa daktari.
Yes.
Kwanza nataka congratulate kwa timu. Tena nataka nimuulize, nilikuwa na shida ya acute pain from my back.
Okay.
Nimekuwa tu ikinisumbua for like 10 minutes, inakuwa acute pain, inakuja inafika mahali inaisha.
All right.
Yeah, so sijui shida inaweza kuwa ni gani, labda anaweza fafanua.
Could you engage with him live before Jeremiah ukate simu, unaweza muuliza directly hapa ndio kujibu pia?
Yeah, so like we said, pain is not normal, okay? So we shouldn't ignore any pain that we experience in any part of our body. So like for Jeremiah, he's saying that he has had this pain. I didn't get clear where he said the pain was originating from.
Unaweza muuliza, he's still on the line.
Ulisema uchungu iko na wapi?
From back and chest.
From back and chest.
Yeah,
the back and the chest.
Yeah.
Okay, so now we are moving away from chronic pelvic pain, because we defined that chronic pelvic pain is actually pain that you're experiencing from the the belly button going lower down. But again, he's still experiencing some pain, and this is something that still needs to be addressed by a doctor, so that they can understand where exactly the pain is coming from, and then based on that they can actually come up with a diagnosis, because the pain is always originating from a certain organ. It's not just from nowhere, Yeah. So I'll advise Jeremiah that he needs to seek medical care from a specialist doctor.
Right.
Yeah.
Jeremiah, hope umesikia hiyo yote?
Yeah, nimesikia.
Thank you. Salimia sana watu wa Machakos.
Salimia.
All right. Continue calling us live as we have this conversation on chronic pelvic pain. Najua wengine wenu mtakuwa very, very tempted to even throw in other pain issues
pain
here.
symptoms, yeah.
But I'm pretty sure you're really up to the task in matters, answering matters, even the pain, generally the body. But then as we have this conversation on pelvic pain, talk to us on the same. So before Jeremiah called, you're to list now.
Yeah, we were discussing the types of, the causes, some of the common causes. Of course, there are many causes, but some of the most common causes of chronic pelvic pain. Like in women, we can talk about chronic, pelvic inflammatory disease. This is a condition that is caused by infections. Most common causes of these infections are actually sexually transmitted infections, which end up causing inflammatory process that causes damage to the reproductive organs or the organs in the pelvis. And then they end up with what we call scarring or damage to the structures of the pelvis. And this can cause chronic pelvic pain. We have what we call irritable bowel syndrome, okay? which is actually an inflammatory process of alimentary system, the colon, the rectum, and such. There are some psychological conditions that can actually exacerbate chronic pelvic pain. Okay, so and that's one of the reasons why I was saying that sometimes we may end up even bringing in a psychiatrist to help us understand where exactly this pain is. There are some work conditions that may exacerbate chronic pelvic pain depending on the type of activity that you're engaging in. We have other conditions like the one we mentioned last time, endometriosis and adenomyosis. Okay? Other conditions like infections that have lasted for long, which you've mentioned. And we have people who've actually gone through road traffic accidents and they actually had an injury on the bony structures of the pelvis. These are also conditions that can cause chronic pelvic pain. Mm-hmm. Now, depending on the cause, like we said last time, endometriosis has actually a specific treatment. So if you're just going to use Panadol for treating endometriosis because you think you have chronic pelvic pain, or if you start taking antibiotics because you're having pain in the lower abdomen and yet you have endometriosis, then you're not really addressing the root cause of this chronic pelvic pain. So it is the doctor's responsibility to actually listen to your story and based on the history that you're giving him, decide which tests they're going to do so that they can pinpoint exactly where this pain is coming from. Mm-hmm. But let's not make the diagnosis for ourselves and decide that I have a urinary tract infection.
Right, let's listen into Fred all the way from Embu. Fred, habari asubuhi, watu wa Embu mkoaje? Hello Fred.
Yes.
Habari asubuhi, watu wa Embu mnaendeleaje?
Tunaendelea vizuri, Embu tuko salama kabisa.
Haya, hata sisi tuko salama. Uko na swali on this conversation ya pelvic pain?
Yes, niko na swali kwa daktari.
Yes.
I've been having pain around my waist.
Okay.
Yes, and also especially at the lower back, the lowest part of my back.
Right.
Just next to back.
Okay.
Yeah, so I've been applying some medicine, painkillers, different types of them.
All right.
Yes, like one which I'm applying currently called the stent snack.
Mm-hmm.
Yeah, so that pain comes, it's on and off.
For how long now?
It's like over 3 months now.
Over 3 months, okay.
Yeah, it's on and off. It comes on and off.
Right. We have Doctor here. Okay.
Yes. I've been wondering, so what's the process?
Right, fantastic. We have Doctor here. Doctor, you can engage him live, maybe you part a clarification on other questions.
Yeah, so one of the things I'll want to know is the history of this pain. Where exactly is it located? He's saying that it's located on the lower back. Mm-hmm. It's coming once and goes. Has he had any intervention? Have you had any intervention by a doctor? Maybe try to just examine and see where exactly this pain is coming from. And if he's using...
no examination that has been carried on me.
Yeah.
Except just taking medicine that they have been prescribing for me.
So it's important that you get to see a doctor because the doctor will also be able to put together a lot of things like your kind of work, because there are some jobs that we do that may actually cause some type of pain that is related to the type of work that you're doing. Mm-hmm. So if you're talking about lower back pain, is it originating from the bony structures of the pelvis, or is it originating from the organ structures in the pelvis? Is it associated with pain in the lower abdomen, in the area that we defined chronic pelvic pain is, or is it just associated with the back pain?
Right.
Remember, chronic pelvic pain may also present not just as a single entity, because someone can have endometriosis, but at the same time they can have pelvic inflammatory disease. Mm-hmm. Yeah. So it can be a comorbid condition. They can be a combination of 3 or 4 conditions that are actually causing this pain. Mm-hmm. And it's important that you go through the doctor's process, and they'll be able to do some investigations for you so that you can understand where exactly this pain is coming from.
And Fred, before you hang up, have you visited a medical professional? What did he or she tell you?
Okay, I visited a doctor somewhere, a clinic.
Okay.
Yeah, and he prescribed for me some medicine which I took for some time. Mm-hmm. And then, the pain cooled down a bit. Mm-hmm. And then now, when it comes, I apply that medicine they were giving me the painkillers, I think.
Right. Dr. also mentions the kind of work that someone does. Do you think your work profession is susceptible to hiyo uchungu yote?
Yes, that time when it was severe, I used to lift some heavy boxes.
Okay.
Yes.
So, kuna swali nyingine ama tuendelee na conversation in case kuna nyingine
nashukuru daktari for the advice.
Okay, sawa.
Thank you so much.
Salimia sana to Embu. Thank you for calling us, Fred. 0795-045-864 is the number to call in live. Our phone numbers are open, and you can engage with Dr. here for your feedback as well as questions. He raises something that I also wanted to get in, because you said 90% is susceptible now to women, but let's talk about the 10% for the men, which you say is quite really rare. But then, so to what, how even for a man, how do you know that you actually have chronic pelvic pain, and when should you even visit a doctor?
So just like the women, the men may also experience chronic pelvic pain, and the pain may present differently. So it may present with some symptoms like constipation. It may alternate with some diarrhea. Okay, you may have pain when you're passing urine. Does this pain get worse when you're passing urine, or does it improve after you've passed urine? When your bladder is full, is the pain worse or is it better? Do you have a problem passing urine, such that you feel your bladder is full, but when you're passing the urine, the pain, you feel like there's some, retention of urine in the bladder? What type of work are you doing? Like, for example, he has mentioned that the pain comes more when he's lifting heavy loads. All these things are factors that need to be put in before we come up with a conclusion on where exactly the pain is. And of course, we'll also have to add some investigations, because if he's saying that the pain is coming because he's lifting some things, could it be a structural problem of the pelvis? And we may need to do an X-ray or a CT scan of the pelvis to be able to identify where exactly this pain is coming from. And then based on that, we can actually be able to direct you to the doctor who is specialized in the area which the pain is coming from, so that they can be able to address this pain.
But then why is it the fact that the numbers are quite low on the susceptibility of pain for men? Is it the fact that men generally wouldn't atasikia uchungu, but then hii itaisha tu, probably after some pain meds, and he knows this will end? Most men wouldn't really want to go to the hospital. And one of the factors really, even for men, the thinking would be, this might be prostate cancer, this might be something very huge. And we mostly say, if you actually don't, if you seek, you'll find.
Men tend to have a very low predilection for seeking healthcare, okay? And that's one. And then the other thing is, most of the causes of chronic pelvic pain are actually originating from structures of the female reproductive system. So I think maybe that will be one of the reasons why more women tend to have chronic pelvic pain than women, than the men. But the other thing is that also that men tend to have a hesitancy to go seek healthcare. They'll prefer to take some pain medication, and then they'll dismiss the pain compared to the women, because the women, the pain normally tends to be more severe, and it actually impacts on their quality of life far much more than the men. Okay? Yeah, but it's not because the men are not seeking healthcare. It's because the causes of chronic pelvic pain are more rampant in the women because of the structures in the pelvis compared to the men. But that does not mean that if you have a pain as a man that you shouldn't seek healthcare. Yeah.
Will you advise for any tips on probably treatment, or on the first few cases of pain, like Esther was mentioning? She experienced one particular pain, I think 3 days ago, but then she has never experienced it before. And now that we're even having this conversation, she's probably worried this is just the beginning of this kind of a whole experience of pain. For someone like Esther, who it's just the beginning, and she might really be in the school of thought that I don't really have to, I'm not there yet in terms of seeking a doctor and medical help. So even before I actually reach there, would I need any tips on probably self-treatment? It doesn't really have to be over-the-counter medicines, but something that can just relieve the pain without having to take pills and all that.
Yeah, so it's difficult to commit myself on whether you should, put some intervention as you are trying to monitor on where this pain is coming from. But it's not bad to, get some painkillers if you're in excruciating pain, of course, as you're planning to go to hospital. Because there might be some factors that are engaged. Maybe you're at work and you're experiencing this pain, you can take some painkillers as you're planning to go to hospital. But there are other factors that can have been shown to actually reduce some of this pain. Like diet has a very important role to play when it comes to pain, especially things like irritable bowel syndrome. Diet has a very important factor when it comes to endometriosis, okay? Exercise has a very big role to play when it comes to chronic pelvic pain. You find that people who are physically active tend to have less of these causes of chronic pelvic pain than people who live a sedentary lifestyle. So yes, it's not bad. You can actually initiate some pain treatment, but that is not to address the cause of the chronic pelvic pain, because as you're experiencing, you still don't know where exactly this pain is coming from. So exercise, dietary monitoring, okay? And just keeping a good mental health check is actually some of the interventions that you can put to address chronic pelvic pain.
Right. In your experience, having children under even the age of 18 having chronic pelvic pain, is it something that is the norm, or is probably something that is quite rare?
It's not very rampant in children. For the reason that most of these causes of chronic pelvic pain actually originate from a process that has been taking place for quite some time. Remember, we said that it's about 6 months duration. But I'm not saying that teenagers and young girls don't have chronic pelvic pain. They can also experience chronic pelvic pain, and we shouldn't dismiss them when they are complaining that they have a pain in originating from the lower abdomen.
Right. Kindly hold that thought on the age factor as you pick this call. Wambua kutoka Machakos. Wambua, habari ya asubuhi?
Nzuri sana.
Watu wa Machakos mnaendeleaje?
Tuko poa.
Haya, mbaba sana. Hata sisi hapa studio tuko salama. Uko na swali on this conversation that you're having on pelvic pain ama maoni tu?
Ni ugonjwa ndio umenisumbua.
Nini imekusumbua?
Imenisumbua kwa miaka 3.
Okay.
Na ndio inanisumbua, ndio naona ile kitu daktari anaeleza.
Okay.
Ndio kinanisumbua kabisa. Kwa sababu tumbo pande moja yangu. Ni tumbo. Ndio inanisumbua mbaya sana.
Right. Unaweza rudia hiyo statement tena? Tulikuwa tumekupoteza kidogo hapo tu.
Ndio nakwambia. Tumbo pande moja yangu.
Okay.
Iko na uchungu, test zote zimefanywa, hakuna kitu. Nilikuwa naanza zimepona. Lakini hiyo tumbo vile inaniuma.
Okay.
Na sababu na uji peke yake tukifanya.
Aya, kama credit imeishia hapo tu ya Wambua. You've got his
I think
concerns?
I picked something that he said he's experiencing pain for the past 3 years. Amesema ni kwa tumbo, which means it's in the abdomen. Now I can't pinpoint exactly which part of the abdomen the pain is coming from. But the fact that he's been experiencing this pain for 3 years, is there any doctor who has examined? Because the first step to identifying what is causing a pain normally is examination. We tend to rush so much into investigations, but we forget that examination is actually a very important part when it comes to determining where the pain is coming from. Is there a doctor who has actually been able to send him for some investigations? Okay. How old is he? Because age becomes a very significant factor when it comes to some of these causes of pain. It's unusual. I wouldn't talk about prostate cancer in a male who is 18 years old. But if someone who is 56 years old tells me that they're having pain in the lower abdomen, they're having difficulty passing urine, then my approach to the investigations I'm going to send them for is going to be different. But again, also we need to understand that the doctors also have different specialties. So if it is a male who has a problem with passing urine, or a male who has a problem with low abdominal pain, then I will direct them to the correct specialist to address the pain.
Right.
So for 3 years he has been experiencing pain, and it has actually really impacted his quality of life. it's something that he needs to be able to, address it from a doctor's point.
Right. Asante. Tuchukue hii simu ya Stella kutoka Naivasha. Stella, habari asubuhi?
Nzuri sana.
Asante sana kwa kutupigia. Watu wa Naivasha, I hope mko salama?
Na wako poa.
Aya, uko na swali au maoni? Unaweza uliza daktari hapa live, atakusikia tu.
Yeah. Okay,
Yes, endelea.
Nilikuwa nauliza
Kabla uendelee, tafadhali zima TV au have it mute tafadhali. Umezima?
Yeah.
Good. Uliza daktari swali sasa.
Nilikuwa nauliza kama chronic pelvic pain ni the same as sciatica.
Kama?
Chronic pelvic pain, it's similar to sciatica.
Chronic pelvic pain is similar to sciatica.
Oh,
Is it similar?
Okay.
all right.
So I want to go back and emphasize what chronic pelvic pain is. Okay, chronic pelvic pain is not a single entity. It is not a disease. It is a symptom. It is what you're feeling. Okay, so you've been feeling this pain on your lower abdomen, between the belly button and the sides of the lower part of the abdomen.
Na labda ndio pia tuwasaidie vizuri.
Yeah.
Kuna wale kizungu kidogo inaweza wapoteza, so you can you're allowed to mix the languages vizuri.
Kiswahili.
Ndio pia waelewe.
Okay.
Yeah.
So if they've been experiencing this pain and you've been having this pain in the lower part of the abdomen, unajua kutoka kwa kitovu mpaka hapo chini, okay? Na hii uchungu imekuwa hapo kwa muda mrefu. Maybe more than 6 months or so. It is either constantly there or it comes and goes. And then it is associated with some symptoms. Are you having pain when you're passing urine? Are you having pain when you're passing stool? Is it associated with your menstrual symptoms? Okay. Is there constipation? Is there bloating or abdominal distension? Now, when you put this together, then you have chronic pelvic pain. Now, chronic pelvic pain can extend to other areas. So there are some people who have chronic pelvic pain, but they say it is also associated with some pain in the inner aspect of the thigh, or it's associated with some pain in the lower part of the leg. Remember, we said there are so many structures in the pelvis that can cause chronic pelvic pain. We have nerves here, we have muscles, and we have all these structures. So sciatica is also, I wouldn't rule it out. Some of the causes of sciatica may actually be a comorbid presentation of chronic pelvic pain, which means you may be having a disease in the organs of the pelvis, but it is associated with sciatica.
All right.
So just because you have sciatica, I cannot say that now you don't have chronic pelvic pain.
Okay.
Yeah.
Tuende sasa Nakuru, where James Mwangi is. James, habari asubuhi?
Salama bwana.
Hey, napenda hiyo saa kumetupigia nayo. Watu wa Nakuru mnaendeleaje?
Tunaendelea poa Nakuru.
Haya, uko na swali concerning conversation yetu ya pelvic pain ama maoni?
Ni maoni.
Tuambie.
Hello?
Yes, endelea. I hope mute TV na umezima?
Nimezima.
Yes, endelea na maoni?
Maoni nasema hii bili ikipita. Hello?
Yes, endelea.
Hii Kenya yetu it will be not the same how
okay. Read the room is what many people would probably say, but then as we are having conversation on matters pelvic pain, maneno ya finance bill tuteka kando kidogo tu, and we'll have it as we continue. Yes, hiyo ni James Mwangi. All right. So back to the conversation that we had even before Nanette Pige Wambua kutoka Machakos kutuambia maneno ya 3 years, and you mentioned something interesting here. The age factor is what we were actually discussing before Wambua tupigie simu. Even below the age of 18 for both men and women.
Yeah.
Well, boys and girls at this age. And I think it would probably be a 12-year-old or an 11-year-old girl coming to you as a medical professional and telling you, I have a chronic pelvic pain. Will that be quite, will that be rare? Will that might be probably the norm?
It wouldn't be rare, but if we go back to the definition of chronic pelvic pain, I wouldn't expect a patient to come and tell me I have chronic pelvic pain. They will tell me they have pain.
Pain, yeah.
Okay? Now, from the picking of how this pain has been presenting, how long they have been having it, and where exactly this pain is located, then the doctor will make that diagnosis that you have chronic pelvic pain. Now, after that, now it is the doctor's responsibility to try and determine what is the cause of this chronic pelvic pain. It is not unusual for a girl who is less than 18 years old to have pain in the lower abdomen for more than 6 months. Because we have had very rare cases, but they exist, of women who are less than 20 years old and they have ovarian cancer. We've had ovarian cancer on women who are even 14 years old. So it is not unusual for you to have chronic pelvic pain at that age. And even endometriosis can even present in people who are less than 18 years old. So chronic pelvic pain can actually exist in that age. But the presentation it may be different, and it may be more common in women who are of an older age than those ones who are at a younger age. Yeah.
Right. With the few moments that we have, minutes that we have, tell us what the kind of takeaway that someone needs to know this morning, or this whole conversation, just to really wrap it up in a summary of what they need to remember.
The first one is always my advocacy, that pain is not normal. And so we need to demystify the idea. There's been a lot of socialization, and I keep on normally saying it. We've made our women believe that it is normal for women to feel pain in the lower abdomen to some certain degree, whether it's because of menses or it's because of something like that. Women should not feel pain, and when they feel pain, then we need to take it seriously, because it is having a very big impact on our economy. It's having a very big impact on our output income as a country. And we need to take a bigger step in terms of addressing chronic pelvic pain, especially in women. The other takeaway message is that if you experience pain and you have been undertaking some self-care treatment for yourself, it's high time that you actually seek specialist attention, and you get someone to actually work with you and take you through this path of trying to determine where exactly the pain is coming from. You may be surprised that it may be something that is so simple that the doctor may actually be able to help you so that you get back to your normal, good quality of life. Yeah. Right.
There's a comment on Facebook. Someone says that I've been experiencing this pain for 5 months. Nikieka kitu baridi ama moto on my waistline. Sisikii as much as venye nitasikia kwa mkono ama other parts of the body. Inaweza kuwa na shida na nerve system yangu.
I can't rule it out. It's possible. But I haven't really got the pain that when they're putting something cold, anasikia uchungu.
Yes, no, they won't feel the cold temperature. So
there's a problem with sensation.
Yeah.
So it brings in a lot of questions, because sensation is a component of our neurological system. And if you're not having sensation, then there are a lot of questions that come in. For example, women who've actually gone through the most common surgery that women go through, cesarean section, they tend to have some degree of loss of sensation in the lower part of the abdomen because of some interference of the nerves. So I don't know whether has she gone through some surgery of some sort. We haven't been given that, and that's why I was saying that it is important that we have a history. Is there a history of a road traffic accident or some form of trauma? Okay. Is there a skin disease that she may be having that may be making her lose the sensation? So all these things need to be tied up before we come up with the conclusion of why she's having these symptoms that she's experiencing.
Right.
Yeah.
I'm pretty sure we'll still have more questions regarding this. Yeah. And even as we wrap up this conversation, probably can direct more and even tell the viewers where they can reach you for more of these queries.
Yeah, so I'm at Iris Medical Center in Upper Hill. That is in KMA Plaza, block 3, third floor. The number directly that you can get me through is 0717 059 419. Yeah.
Right.
And I'm always happy to answer any questions that they have.
Right.
Yeah.
Well, thank you very much to everyone who's been part of this conversation, those who called in live and those who texted us. Even on Facebook, we'll be continuing with this conversation and continuing on digital platforms. We're asking you, have you ever experienced any kind of a chronic pain? And have this kind of a conversation every single Monday from around 8 a.m. to 9 a.m. Later on, we get into matters oral hygiene with Dr. PJ Muriuki, just to understand, ukiamka asubuhi, what do you do? Is the first thing that you do when you wake up? Do you brush your teeth first before you eat, or vice versa? How do you probably just sometimes actually do all the necessary and then still have a bad breath? What is wrong with your oral hygiene? We'll be getting to dissect that. So again, if you also wanted to call us live for this conversation, don't worry. You can also be part of the next. 0795 045 864 is the number to call us live.